A bakery declining to make a wedding cake for a same-sex couple. Sure, one could make a case based on the baker's religious beliefs, and one did, and they took it all the way to the U.S. Supreme Court. But a medical doctor refusing to participate in the procedure for the same reasons? If Idaho lawmakers get their way, that could be the case, citing a separate crisis in Idaho's medical community, not of a shortage of healthcare professionals, but more like calling it a war on their beliefs. Joe Paris is following this Medical Ethics Defense Act, and guess, Joe, the question is, could a doctor just say no to anything?
There are some guidelines within it, Brian, but if it is really an honestly held belief, yes, doctors, nurses, pharmacists, they would have room in this new legislation to do just that. So it passed the full Idaho House today, and the core purpose of it is to protect healthcare providers' quote-unquote right of conscience, allowing them to opt out of a medical procedure for ethical, moral, or religious reasons. And it would apply, as I mentioned, doctors, nurses, pharmacists, social workers. You may remember counselors and therapists were covered last year by a bill that was passed by lawmakers. The governor signed it into law. But what about this? What are they talking about?
Assisted suicide, dispensing marijuana and mind-altering drugs, gene editing or other genetic manipulation of children in utero, removal of otherwise healthy body parts on people on sex change purposes, prescribing sex change hormones or puberty blockers for children for sex change purposes, and then various injection products. We didn't have objections much at all at committee hearing. We had many people testify, but no objections.
So a little bit of a correction there. Public testimony did include mostly people in favor of this idea. We heard from medical people from across the state of Idaho saying that they felt under attack, but there are Idahoans who say they disagree with this bill.
A pharmacist could refuse to dispense antidepressants. An insurer could refuse to cover certain types of birth control. A physician could refuse to provide healthcare services to a gay couple or their children.
Many communities, if they have any, only have a hospital or a single clinic or one pharmacist. So if that provider refuses care, what options are left to them?
Planned Parenthood and other groups worry that women and LGBTQ Idahoans won't have enough places to seek care they need, especially in small communities. And to be very clear, emergency care must still be provided underneath this act.
I'm sure. And I guess the same could apply then for, like, I don't know, during COVID when pharmacists were saying no to prescribing ivermectin.
Yeah.
I mean, I guess that could apply to that too.
principle.
All right, but that was based more on science. All right, thank you very much, Joe.